Hello, this is Dr. Jeffrey Fudin, bringing you a demonstration on Remitigate's new Urintel software application, which is intended for use to help determine the results of urine screens by immunoassay. The first screen asks that you agree to the terms of service, and please scroll down on the right side, read those terms, because you need to scroll down in order to accept these terms, which brings you to the next screen. The next screen discusses best practices, and it tells you that you should consider certain variables. For example, comprehensive patient or caregiver education, consider opioid or controlled substance agreement, and consider the risk assessment tools, some of which are listed here, and these are to determine the risk of substance abuse or misuse. Finally, consider home naloxone for safety purposes, either by auto-injector, by injection kit, or by intranasal. After you acknowledge that you've considered these things, it brings you to the first screen of the application. In this application, you're allowed to select medications either by pharmacological class or you can type them in. So the very first screen is asking you what medications are prescribed to the patient. So I'm going to walk you through an example. This patient, female patient, is on opioids, and the opioid she is on is oxycodone. Click the arrow, bring it over, type in the milligram dose for the day, in this case 20 milligrams. Benzodiazepines, you could select, for example, alprazolam, but just to show you, in this particular case, we will type it in. The patient's on alprazolam, 2 milligrams per day. Antidepressants, the patient is on venlafaxine, also known as Effexor. The patient is receiving 250 milligrams per day. And finally, the patient is also on an NSAID. In this particular case, the patient is on naproxen, and the dose for the day is 1,000 milligrams. Then you click the next screen. On the next screen, you are given a standard panel at the top, which includes the substances that are most often tested for by immunoassay in a standard panel. And then below that, there are optional add-ons. So for example, the oxycodone screen, which is more specific for oxycodone than opiates in general. Methadone, which may or may not be included in your typical panel. And then the last four, which are rarely included in typical panels by immunoassay, and that includes buprenorphine, fentanyl, tramadol, and pentadol. So scrolling back up to the standard panel, here's what we see. So this patient was on oxycodone 20 milligrams per day, but nevertheless tested negative for opiates. The patient was on a benzodiazepine, in this case alprazolam, 2 milligrams per day, but the screen came back negative. Amphetamines came back positive, which were not prescribed. Barbiturates came back negative. Cannabinoids were not prescribed, but came back positive. Cocaine came back negative. And PCP, illicit hallucinogen, came back positive. So let's just review this. The patient had oxycodone 20 milligrams per day, opiates negative. The patient had alprazolam 2 milligrams per day, benzos negative. The patient was not prescribed amphetamines, result positive. Barbiturates were negative, cannabinoids not prescribed were positive, cocaine was negative, and PCP was positive. Doesn't look good for this patient. Next screen. This asks a very important question. Is the patient taking oxycodone around the clock or as needed? In this case, the patient's taking it around the clock. Click Next. Now the Urintel application is analyzing the results, and you can see the recommendations are here. So, opiates. Negative result is not unexpected because the total dose of synthetic opioids may be too low for detection. Okay, now had this patient been prescribed morphine, for example, and it came back negative, that would have been a problem. Had the patient been prescribed a much higher dose of oxycodone and it came back negative, that would have also been a problem, but Urintel figures that all out for you in the background. The cannabinoid test. Positive result is not unexpected because the false positive naproxen, which you added in the first screen, was detected. And it asks you, click here for false positive. So you'll see here that naproxen is in fact listed as a false positive, although it is a low impact and does not usually happen. Amphetamines, in this case, amphetamine positive result was not unexpected because amphetamines are not prescribed. Recommend discussing this with patients. You can click here and you will see that this particular patient actually was prescribed levodopa carbidopa, and that is the reason why it could be plausible that the amphetamine tested positive. Looking down, cocaine test was negative as expected. PCP. Positive result is not unexpected because the false positive venlafaxine is detected. All right, and then you can click here and it will tell you that. The barbiturate test was negative. The benzodiazepine test. Negative result is not unexpected because the prescribed benzodiazepine, which in this case was alprazolam, can provide a negative result. Had this come back positive, it would have warned you that it is very possible that something other than alprazolam was actually taken by the patient. So scroll down a little bit further, and it also does make recommendations that if a patient is very high risk, you might want to consider ordering synthetic cathinones, as you can see here, or synthetic cannabinoids, which will not test positive on a typical urine panel. That's a special send-out. And then finally on the bottom, you will always get a warning for your patients if they are on a combination of opioids plus a benzodiazepine, reminding you that you might want to consider lowering the dose of one or both. And that on the bottom, it will give you the windows of detection for various of these drugs. Okay, now in addition to this, you could use this information and print it out, and in a office-based type practice, you can use this printout to fax over to a third-party payer to justify your decision to send this sample out for definitive testing by quantitative confirmation. Because in this case, although it's plausible that many of these tests came back and were totally legit, you could have something very, very different where the opposite happened. We need to justify that the patient was or was not taking the medications prescribed. So in this particular case, what we might want to do is print the PDF, and you can type in the information in this free text box. So for example, the patient's name, I think you know her. Her name is Lily Cad. And the data was entered by somebody else who I think you know pretty well, Wilma Flintstone. And Wilma is an LPN. And then there's yours truly, Dr. Jeffrey Fudin, who's ordering this test. And then so you know this patient, and you can really type in anything that you want here. This patient is receiving levodopa carbidopa for Parkinson's disease, which could cause a false positive. Oh, this is wrong. For Parkinson's disease can cause a false positive for amphetamines, right? Okay. And all other unexpected results seem plausible according to Urintel. I know the patient well and do not suspect any non-compliance issues. So now you can take this and print it. So we're going to print this, and we're going to call this Wilma, and let's see, we're going to save this, and after we save it, we will open it up. I just got to find it. And there it is. There she is, Wilma. Okay, so Wilma, let me just make this a little narrow for you so you can see what's going on. So there we go. This is what the report is going to look like for you. And you can see that the Urintel logo is on top. Where the patient was lily pad, the data entry was for Wilma Flintstone, was done by Wilma Flintstone. And the clinician notes are listed here. Parkinson's disease, which could cause a false positive for amphetamines because of the levodopa carbidopa. Down here it lists the drugs, and then we've nicely bolded all of the initial outcomes and the results and what we recommend for this particular patient. And so that's it. You can take this information, you can leave it in the chart, you can share it with the patient. One of your MSAs, LPNs, or whoever can share this with the patient, and you can fax this report over to a third-party payer to help you justify payment for ordering confirmatory testing by quantitative confirmation. Thank you very much. Good luck. Enjoy the application. Have a nice day.